The NCD fight is an urgent need. There's an urgent need for structural and concerted efforts to address behavioral and lifestyle factors, as well as finances, policies, regulations, consumer education, and innovations to halt and reverse the trend. Talking of innovations in NCD programming, do you know that if we invest 100 shillings in scaling up actions against NCDs, the country, like Kenya, will gain 700 shillings in terms of increased productivity, employment, and longevity? And do you know that some of the interventions, like promoting healthy diets, the return is even bigger. For every 100 shillings, you get 1,300 shillings. For reducing harmful use of alcohol, for every 100 shillings, you get 900 shillings return on investment. Drug therapy for cardiovascular diseases like hypertension and that, you get 300 out of 100. And increasing physical activity, you get 300 out of 100. From where I start, as a person, as an organization, and where we start as a country, this makes plenty of economic sense to ourselves, to businesses, and to our government to respond to this situation. We need to get young people into this conversation, because if we don't, we lose it even before we begin. Because exposure to risk, NCD risk factors starts as early as 10 years. So even in the schools, in the TVET institutions, universities, this is where the conversations need to be happening. Number two, we need to invest in primary health care, and including community health workers. When your mom in the rural area goes to that health center or dispensary, they need to be able to get screening for NCDs and get treatment or be referred effectively. So many people get blood pressure maybe once 5 years instead of annually. How can we change all this? And finally, it's about leadership. We have got to offer leadership. If we don't, we will be letting down our country. I remember once for the HIV/AIDS epidemic, the President of the Republic had to declare it a national disaster. What stops us as a country from getting to that point where the President announces NCDs as a national disaster? What stops us from recognizing NCDs as a national disaster by the end of this conference, so that we begin actually getting the political goodwill? We begin putting this at high level so that we can have effective interventions and at scale.